Okay, this is part 2 of the ICD-10 CM scan. We're going to, for the ICD-10 CM 2026. So we want to make sure that we are putting all of our highlights, underlining, and notes in our books. So now we're going into section 1, and we're going to C. And in C is the chapter specific where you have all of your guidelines. So now what we're going to do is, and make sure, I did tell you in the first video, make sure you have however many highlighters. I have all of these in a red pen. So just make sure you have your highlighters. And what we're going to do is, first and foremost, I like to do this way first. I take my, and I want to be sure I have the same color. That's not the same color. I have this one here. So I want to make sure what I do is in chapter 1, I'm actually going to go through in section C's, chapter specific coding guidelines, and I'm going to highlight all of my chapters one color. So this chapter 1, certain infectious and parasitic diseases, I'm actually about to use my marker, and all of my chapters is going to be the same color. This way we know once we get to this color, we know there's a new chapter, okay? So let's go ahead and do all of the chapters, and you can choose any color you want. I'm going to go ahead and choose this color here. So chapter 1. Now let's go find chapter 2. And I want y'all to find chapter 2. And just go through your book until you get to chapter 22. So here's my chapter 2, neoplasms. That's what we're doing. So I'm going to chapter 3. And of course, if you get to chapter 3, they don't have any guidelines, but I still make sure that I highlight it. And then I'll do chapter 4 and so forth. And this may not be looking too neat, but I don't have to take the test, so I'm just trying to be sure I show you guys what I do. I go chapter 5. Where's chapter 6? So you want to do this throughout your book. Oh wait, I passed up chapter 6. Chapter 5, chapter 6. Okay. Chapter 7. Okay, chapter 8. They don't have any guidelines for chapter 8, but we are still going to do it. And chapter 9. Okay. Let's look for chapter 10. And we're making all of our chapters the same color, so we know when we get to a new chapter. Chapter 10. Chapter 11 don't have any guidelines. It's a self-explanatory area. And then chapter 12. And this is what we want to do. Here's chapter 13. Chapter 14. Chapter 15. All right, and that's a pretty big area right there. So we're looking for chapter 16. And you guys can start and stop this this video as many times as you need to. Chapter 16 is the babies. Chapter 17. Okay. Chapter 18. Chapter 19. Okay, let's find chapter 20. Chapter 20. It's right here on page G28. Chapter 21. G30. Page G30. Chapter 21. All right. And let's find chapter 22. And it's right here. Page G34. All right. So now that we have completed highlighting our chapters, we're going to go back to the beginning of C and start with chapter 1. Okay? And we're going to just highlight and put some notes in here. That's all. We have to be prepared for that exam. And we want to be prepared as much as possible. So yes, we're going to add some notes and stuff in here that will allow you guys to understand what you're coding and making sure you understand it. Okay. So I'm not going to fold my book. I'm going to just let it slump over like that. Just make sure you guys can see. And I feel like it's a little dim. That might be a little bit better. Okay. All right. So now, as long as you have your red pens and you have your other colors, you can use any color you want. I'm going to just kind of stick with kind of like the same color throughout. But you can use any color you want. Okay. All right. So now, first thing you want to do is right here by code only confirmed cases. We just want to put first ST and we're going to put B20 right there. Confirmed cases will be this particular code here. All right. And I'm going to go ahead and highlight my section sets in here. So we're going to do 1 and then we're going to do 2. Now, the reason why we're going to do 2 is because here is a new, see how it's all bolded? This is HIV disease. This is actually a new guideline. So whenever you get the new books and when it's all the whole thing entirely bolded, that means that's a new guideline. Okay. So with that being said, now we're going to go into, so it says if the term AIDS or HIV disease is documented, or if the patient is treated for any HIV related illness, or is described as having any conditions resulting from patient's HIV positive status, code B20. Okay, so we just want to make sure that we highlight this, because this is definitely letting you know. And what we're going to do is, let's go ahead and circle that so we know where we need to go. Okay. All right. And then for this one, for B, it says patient admitted for HIV related condition. All right. And in here, even though we highlighted that, and like I said, I'm going to use the same highlighter. You guys, if you want to take the headings and put this one color and then in here do another color, you can. So it'll probably look like this here if you do it that way. To each his own. Do it your way, but I'm just trying to show you what you need to highlight in here. So we want to highlight that, and then code D5931, and highlight that underneath there. So it'll kind of look like this here. And this here should have probably been orange too. However, like I said, I'm just going to code everything one color. I'll do the two colors for just kind of showing you guys so that you make sure you're doing it correctly. Because I know it can be a bummer just, you know, going back and forth through the colors or whatever. All right. Now, patient with HIV admitted for unrelated. So I'm going to highlight this section yellow because we got a note to put here. Okay. And then I'm going to tell you, this is the note that you want to have here for this section here. Your first code should be B20. And your second code should be the HIV related illness. And you want to put that right by C. And if you want to, you can actually do this. So it could kind of stand out in that section so you could see. So that went with C. Okay. Now, patient newly diagnosed with HIV disease. We're just going to highlight, these here. All right. Here's another guideline. It's bolded. They're putting some new stuff in there. So that's awesome. I like it. I like it. Okay. Now, this here we're definitely going to highlight because I want you guys to pay attention. These charts are really, really good. And the reason why I like the charts is because it kind of tells you like where to go at. Like it says, a patient's chart reads HIV positive or HIV test positive. Is a condition the patient is being seen for HIV related to HIV? Yes. And you will code this. No, and you would report the unrelated condition first. And what I'm going to do is we're going to circle this word first because this makes a difference. And then it says followed by Z21. Okay. So we're going to go ahead and do the rest of that. And we're going to circle that. All right. Now, underneath here, inconclusive. So your inconclusive serologies, this is just basically telling you what you need. So let's do this. Inconclusive. This is your code for it. And like I said, I was going to use two colors. So let me go ahead and use two colors so you can see how that looks. I should have done that like that. Okay. Previously diagnosed, HIV related. We're going to go previously diagnosed. Okay. And then in that paragraph here, and we're on page G7, in that paragraph, we want to code highlight, B20 right here. All right. And then we also want to highlight B20 assigned, this one right here. And then we're also going to assign this here. And then underneath there, assign R75 for inconclusive. And it's telling you it should never be. So never be. Let's go ahead. B20 should never be assigned to R75 inconclusive laboratory evidence of human. This never be right here, we're going to underline that. Okay. All right. And then we have HIV infection to pregnancy. And we're going to go ahead and highlight this section here, H. And underneath it, this is the code. If someone is pregnant with that, you want to use that 098 code. And then you also want a code followed by B20 and any additional codes for HIV related illnesses. So make sure you have all of that highlighted as well. Okay. Now, encounters for HIV testing. We're going to do this. And now we're going to go Z11.4. You got Z71.7. And these are all different. This one here is for screening. This one here is for counseling. So we're just making these things kind of stand out. Okay. All right. And then we have HIV disease or HIV positive status managed by antiretroviral. Okay. And we're going to do this. And then let's go ahead and assign. And it says, if a patient with documented HIV disease, HIV-related illness, or AIDS is currently managed on antiretroviral medications, assign B20. We're going to copy that whole paragraph. Not copy, highlight, sorry. And we're going to circle that B20. And let's underline the word assign. Okay. Now, if they're currently managed on antiretroviral medications, and you can assign code Z21 if they're asymptomatic. So if they don't have any symptoms at all, but they're taking a medication, then you assign the Z20. Okay. And this is just if they're documented positive. They have no signs. So let's go ahead and circle that Z20. All right. So that's how it should look throughout your book when we put these things in here. And we're going to make sure that we are even putting our little notes here, because this stuff here is going to help. This is like pulling from the whatchamacallit and saying, hey, look, if it's this how you code it. The first code, second code. You take the guessing out. So that's what we're doing. We're taking the guessing out. Okay. Let's turn the page. We're on page G8. G8. We're in the 2026 ICD-10 CM. And we are going on page G8. And we're just going to go ahead and highlight this. All right. And just so you know, for this, let me do this here, just so you know what this is here. See how we did this here, this area right here? When they are managed on the drug, if they're trying to figure out the actual drug, the drug is coded to this. So we're going to put, let's just put the drug, the word drug right here. So that you know the drug is coded to this here. So some drugs have codes, and it's specific to that drug, but this particular code here is just other long-term. And this is basically saying that it's a other long-time drug because it's not specific. They currently taken, but they've been taking it for a long term. Okay, so that's what that means. All right. Now, let's go to our infectious agents. Let's get into that. I'm going to do this. Highlight B. And after highlighting B, in there, a code from category B95 right here. That's what you want to highlight. So this here is basically saying, see, this is how we kind of make these stand out on exactly what it is that they are looking for. You want to make sure that when you are, like, see how we highlighted this here? This whole paragraph, even though it gives you all the information and you still may want to read, but it's letting you know whatever it is that you read in this paragraph, it needs to come from here. That'll ensure that you're in the correct area in making sure you're coding it correctly. That makes sense. Okay. All right, let's go to C. And we could just highlight C, y'all. I want to kind of get into these other, and we're going to highlight D. For sepsis. And this is what I want to do. I want to make sure that you guys know what this here is. So we're going to write sepsis. Right there. Write sepsis. So when you come to your guidelines, when you see this word in red and it says sepsis, you know that you're in the area where you need to be. And now you can do what you need to do. So for that, we're going to go ahead and it's going to tell us the code A4179 right here. Right in A, code A41.9. And then it says a code from subcategory R21. And you got to finish that code out. Okay. So this is how your sepsis should be coded. Let's go first. It needs to be the infection. Second code should be the R65.2. And we're going to put a dash right there because we don't know if it's going to be 20 or 21. And then third, let's put organ. It's I believe it's organ. Let me tell you, I don't want y'all to write the wrong word. Organ dysfunction. That's it. Organ dysfunction. But let's do this in parentheses. If applicable. So this is how you code sepsis. The infection will always be first. Then it'll be R65.2. And we got a dash here because we need the digit. We don't know what this digit is going to be. And then it's going to be your organ dysfunction if applicable. And then we're going to take that and let's just do this. So now we know how to code sepsis. You always code it in this order. So if you ever worry about sequencing, you've just sequenced it. You have just sequenced it, okay? And we can do this as well. All right. And then we're going to go to severe sepsis right here. We're just going to highlight. We're just going to highlight. And in here, it says assign. Now, let me say this. Will it always be A41.9? No. It's whatever the infection is. If they specify the infection, then you code that infection. If it's not specified, then that's why they're telling you to use that. Okay. And we're going to do right here. Okay. Now septic shock. Let's go ahead and highlight septic shock. And in septic shock, we're going to code the R65. I want you to highlight R65. And then also code this here, so you'll know what that means. Number 3. You want to make sure it's on here right. Severe sepsis. And we're just making some things stand out so y'all know, y'all. That's all. Doing R65 subcategories, R65. And then in this right here, it says R65.2 should be assigned as secondary diagnosis. And we're going to take an underline, secondary diagnosis, which lets you know second. R65.2, second. That's the reason why I put them in order, so that you can see it. All right. All right, let's go with this here. And it still says the same thing. So it's like no matter, same thing. And we're going for the secondary. Lord, I don't have a steady hand no more at all. I've been doing this for so long, now my hand don't want to. There you go. Sepsis due to post-procedural. And then let's go over to the next page. We're on page G9. We just highlighted 5 sepsis due to post-procedural infection. Remember, I'm just doing this so you can see it. You can always start and stop the video, pause it, so that you can actually see what it is. You can go back to it if you need to. So we're going to highlight B and C on page G9. All right. So we're going to do this here and C on G9. And then we're going to take our orange and we're going to highlight right here. Okay, sepsis due to post-procedural. These are your code categories. So a code from T8141 and 43, 49. That's what you want to highlight right there. Okay. And then they say sepsis, T8141, sepsis following obstetrical. So let's do that. Plus that. Okay. And make sure when you have your highlighters that they don't bleed. And then once again, it says R65.2 should be assigned with the additional code. For any acute organ dysfunction, highlight that as well. All right. And this is how you code it. You already know. We already wrote down how to code it or whatever, however you need to. So just make sure. All right. We're going to take and go 6. And if it makes it simple and easy for you guys, this is what I'm doing. See these numbers? No. And look, when I get to this methicillin-resistant Staphylococcus aureus and it says MRSA, I'm about to write MRSA right here. This lets me know that I'm in the MRSA area. And you can actually take and put a line across there because this is going to stop all your sepsis. All right. And let's go even further. Let's go ahead. I'm gonna do something else too. Let's go right here by Zika virus infection, we're going to put a line because that's going to stop your MRSA. Put a line right there. And then when we get to coronavirus infections, we want to write COVID right here. So that's how we're going to do that, you guys. All right. Now I'm going to go back and do all the highlights and stuff that we need for this particular section here so that you know. So MRSA, it says code. We got to do this, 841.02. And that says sepsis due to MRSA. All right. And then it says J15212 is pneumonia due to MRSA. And what we're going to do, we're going to make this stand out. So let's go ahead and circle A4102 and circle J15212. So we know where we need to go at in here. And then this is what we're going to do. It says right here, do not assign. And what I'm going to do, instead of highlighting that, I'm going to do underline. Do not assign code B95. I'm horrible. I don't have a steady hand at all. And we're going to go all the way. We're going to stop right here. It says, do not assign code B9562 MRSA infection as the cause of diseases classified elsewhere as an additional code because the combination code includes the type of infection. So let's go ahead and highlight that, underline that, I'm sorry. Underline, underline, underline. I'm horrible at this now, y'all. I used to be so straight-handed. Okay. So that's what you want to do. Okay. And we just did that under E, number 1, A, and then in this paragraph. Now, let's go to B, other codes for MRSA infection. We're going to, of course, highlight this as yellow. And then we're going to go ahead and highlight do not assign code from right here. Remember, make sure you're using highlighters that don't bleed through. Okay, that's how we're going to do that. And then we're going to make sure that we do this. All right. And what we're going to do here is going to make so much more sense for you because this is both. So because this is both, we're going to do MSSA and MRSA. And go ahead and highlight that. All right. Now we're going to go down to Zika virus. And Zika virus, we're going to do A95.2. Highlight that. And it says only code confirmed cases, of course. And that's going to be the code there for the confirmed case. And we're going to come down here to A95.2. It says, if the provider documents suspected, possible, or probable Zika, do not assign code. Now we're going to highlight that. But we're also going to underline do not code. And then see these words here? Circle, suspected, possible, probable. Any word that seems uncertain, because they don't know. So if you see these words, suspected, possible, or probable, you do not code that. That's what that guideline is saying. And if someone has come into contact with it or suspected to it, then you can definitely use this code right here. All right. Now we're going to go to COVID-19. And for this area here, this is kind of, they made this area pretty straightforward, honestly. So we'll just go ahead and do this. It says code only confirmed cases. And the confirmed cases, it's going to be this code here, code U07.1. And once again, we're going to highlight this. Oh, I wanted to use the same one. I'm sorry, you guys. The same paragraph. Let's go ahead and highlight this same paragraph, because this is very important. We're going to circle suspected, circle possible, probable, or inconclusive. Circle inconclusive. These are all your keywords. We're going to underline do not assign U07.1. And then let's do this. We're going to put, it says code signs or symptoms. That's what you want right there. So this is how we make these things stand out. This is how, when you come to this guideline, instead of reading this whole paragraph, it's like, okay, I got a confirmed case. I know the code. I have this here. But what if, what if they say suspected? Bam, there's your thing there. Suspected, it says do not code U07.1, code the signs and symptoms. Now you know to go back to your report and code only the signs and symptoms. Okay. We're going to go into the sequencing of COVID. Let's go ahead. Of codes, I'm sorry. So, when COVID-19 meets the definition of principal diagnosis, you code it. That means if after giving all of their signs and symptoms, and they took a test for COVID, and it's confirmed that it's COVID, then this is what you're going to code, COVID. So that's what they mean by the definition of principal diagnosis. That means that's what they came in for. This is the principal diagnosis. And then it says it should be sequenced first, right? Followed by the appropriate codes for associated manifestations, except when another guideline requires that certain codes be sequenced first, such as obstetrics, sepsis, or transplant complications. Now, they're basically saying in this particular guideline, you got COVID, right? And that's your code. We're going to do that first. What has manifested from the COVID? You can have like a post-COVID cough or post-COVID. What's the manifestation? And if not, you're going to have these obstetrics, sepsis, or transplant. You use those codes. You sequence these codes first. Remember, the old codes trump all the codes in here. All right. Then this one says acute respiratory manifestations of COVID. Let's go ahead and highlight that. And they have a couple. So because they have a couple, what we're going to do is we're just going to highlight it. And guess why I'm going to highlight that? I'm going to highlight that one in a different color because what color do I want, y'all? I want to do, no, that's the one. Oh yeah, we can do that one. This is just examples. These are common. So go ahead and do that. That'll give you an example. And then it says non-respiratory. Okay. Non-respiratory. Let's go ahead and highlight that. I'm on page G10, and I'm just highlighting my letters. E, D, F, G. H. All right. I, J, K, L, M, N. Now, let's make some things stand out. Okay. So this here is letting you know if you got signs and symptoms without a definitive diagnosis of COVID-19, it's basically telling you code those signs and symptoms. And these are some examples right here. That's under G. And if they have come in contact with someone who has had it, this is what we want to code, assign this here. We're going to highlight that. Okay. Now, for someone who has asymptomatic exposure, this is that code again. So I just want to make sure we got that. That's under E. Let's come here. This is a new guideline. For asymptomatic individuals who test positive for COVID-19 and there is no provided documentation of a diagnosis of COVID-19, you query the provider. This here is only going to set in a work-related area. So where I'm going to have you to highlight this, so that you know once you get on your job, once you become a coder and you're on your job, because you're going to become a coder, this is where this would apply, because you can't query a provider on a test. Okay, so we're going to go ahead and highlight that. And what I'm highlighting is that whole thing until I get to the period. Highlight that whole sentence. And then if someone has a personal history of COVID, you assign this code. Okay. And let me make sure, because I don't think I have anything else. Oh, yes. Let's go to L. L. For individuals, let's go ahead and I want you to highlight this here. Multi-system inflammatory system, MIS. And it's going to tell you what to code. Do that. And then post-COVID under M, this is your sequela. You're going to assign those codes specific related to the infection if known. Okay? And it says, I'm doing that whole paragraph right there, y'all, just so you know, because I know. And it says, if known, and it's telling you what to code. And of course, we're going to make that stand out, right? So we're going to underline if known. And we're going to circle U09.9. All right. Now we're in chapter 2. Now we are in chapter 2. Now let's get into it. Chapter 2 guidelines. We want to go to, and this is your neoplasms, right? So we're going to go to admission encounter for treatment of primary site. A, admission encounter for treatment of primary site on page G11. All right, let's get into it. So let's do a little different. We're going to do the orange here. You can do this if you want to. We're just making these things stand out. These are all the letters. Now, I highlighted all the letters in here. All of the letters. All right. And now we're going to go back in and make sure we have everything. So now I'm going to start picking up and just telling you what to highlight, because we have to get to 22 chapters. But now that you have an idea of how we're going to do this, I'm just going to move a little bit faster so that you know. Okay. So we want to, and I'm going to just call out the sections. You just highlight or you just write, but I'm going to call out the sections so you are aware. All right. So for this one here, what we want to highlight up in here is principal diagnosis. And it should be principal first admissions and diagnosis right here. Highlight that principal first listed diagnosis. And when it says the only exception, you want to do exception right there. Highlight the word exception. And then you want to highlight chemotherapy and immunotherapy right there. And then the appropriate codes for those will be the Z51. So that's how we want that to look. Principal first listed diagnosis, exception, chemotherapy, immunotherapy, and then appropriate Z51. That's what we did. Okay. Now, admission for secondary, treatment for secondary, no, we should be fine with that. Just basically know this. When a patient is admitted because of a primary neoplasm with metastasis and treatment is directed toward the secondary site only, the secondary neoplasm is designed as the principal diagnosis. This is what you want to. So metastasis means metastatic or secondary. And if you want, you can take this word here and just do an arrow by secondary, because that's what it means. Okay. Coding and sequencing of complications. So when it's anemia associated, and this is what we're going to highlight so we know exactly what to code. Anemia associated, it says you're going to do the first listed the principal or first listed diagnosis followed by the appropriate code for the anemia. So it's going to be the malignancy first, malignancy, and then anemia. Malignancy and then anemia. For the anemia associated, chemotherapy. When the encounter is for management of the anemia associated with an adverse effect of administration of this here, is only for the treatment for the anemia code is sequenced first. So anemia sequenced first. And you want to follow this by the neoplasm, which we already have highlighted, any adverse effect. So let me tell you how we're going to do this. Let's do 1, 2, 3. That's how you code it. Anemia first, neoplasm second, adverse effect third. All right, malignant neoplasm of dehydration. The dehydration will be sequenced first. Highlight that. And your dehydration is E. 86.0. Make sure we got that point right there. All right. Treatment of complication. Designate. Sorry. Designate the complication as the principal. There you go. And then you got D for the primary malignancy previously excised. You want to go Z85, that's going to be your category for that. And then they say the secondary site, this last sentence, highlight that. Right there. Now you're under E, administration. We don't have anything for that one. Let's go to number E1, E2. E2. All right. We have the radiation. We have administration of chemotherapy, immunotherapy, external beam of radiation therapy for the treatment of a neoplasm. Sign code Z51. That's what you want to highlight right there. Okay. And let's see. We don't have too much anything else. Now, let me tell you this. This graph is amazing. This column, it tells you the reason for the encounter. This column here, it tells you how to sequence the actual codes. And it's going to tell you what goes first. So if you have treatment of a primary malignancy, the primary site is first, the metastatic sites are second. Treatment of secondary malignancy, the metastatic is first, then the primary site. And remember, the key words in these two here is treatment. So if they're only treating the secondary, that's why it is primary. And then the primary site is where it metastasized from. So in other words, let's just say lung cancer, and then was the primary, and let's just say it spread it to the kidneys. So lung is primary, kidneys is secondary. So in this instance, they're treating the lung. In this instance, they're treating the kidney. Hope that made sense. All right, so this here is wonderful. You can highlight this however you want to. You can put a circle around it, but just make sure you pay attention to it because this is very, very, very important. All right. Let's turn the page. This way I should have my rubber finger at. All right, because we got some other things to go over in here. All right, and we have to go to admission encounter. So remember, we're going to make sure we highlight these H, I, J, K, L. Page G12. M, N, O, P. We really don't have to do nothing with those, but I just like highlight them, y'all. And if you don't want to, you don't have to. R, S, and T. Okay. I'm trying to see, do I have any notes for any one of those? We just have them highlighted, but sometimes I don't have any notes for them because when I don't have any notes for them, they're kind of like a straight, area where it's just, it is what it is, you know? So let's go to, no, we have everything we need there. Yep, we have everything we need here. The sequencing, we already have the table on the other side, so you already know how to sequence. So this area here, is kind of telling you right here. So if you want to, you can take and put C table page, put this on G11. G11. So now you know how to sequence all of those. You just go to this table pretty much. All right. All right, let's see what else I have in this area here. I do have a couple things. You want to make sure you have category C90 for multiple myeloma. You will see this a lot. All right, so that's why we're going to highlight that. And secondary malignant neoplasms of lymphoid tissues is going to be in categories C81 to C85. Make sure you have that. And if it's the lungs, the B cell lymphoma due to the lung, brain, and left gland, assign code this here. So we're gonna highlight that. And it says diffuse right there. Got it? All right. Now, another thing you guys can do if you want to as well, this may be helpful for some. It might be too much. I don't know. But even though we highlighted our chapters, if you want to, you can put a star or an asterisk, whichever one, at each chapter so you know where it's starting at. That's if you want to. That's totally up to you. I'm just giving you different ideas. All right. Now, this first thing with diabetes, we want to go ahead and highlight this first sentence. We're in chapter 4, page G12. Highlight that first sentence. We're going to highlight type 1 under number 1. And let's do this, y'all. Like I said, use your colors. Use them how you want to. Use them how you want to. Okay. And then even though we type that, we also want to highlight juvenile. So under number 1, chapter 4, A1, in this paragraph, you should have type 1 diabetes highlighted and juvenile diabetes highlighted. All right. And just so that you are aware, well, I'll tell you that when we get over there on that particular side. This here is good. All these pretty much stand out and they're bold so that you know. But in 2, highlight this. We're going to highlight it with this one here. And then I want you to highlight E11. Default E11. That's what I want you to highlight under there. Number 3. These are your injectables and your orals and all of that. You want to make sure when you are assigning these particular codes that you're coding the correct ones. And in this paragraph, we're going to highlight those correct ones. But we're going to write some things, and I'm going to close this book a little bit. All right? Because we want to make some things stand out here. All right? So right here in chapter 1, okay, there's a couple things. E10, write this. E10.9 is type 1. And type 2 is E11.9. That's what you want right there. Type 1, type 2. Okay? Just so that we know. And then, let's turn the book over because we got some stuff we need to make sure we write when we get to it. But for this here, this is a beautiful chart. And first and foremost, it says, is the type of diabetes documented? If yes, report the type that's documented, and no, report type 2 diabetes. So you can go ahead and put E11 point, and I'm going to put a dash here because we don't know if it's going to be a 9 for just unspecified diabetes, or it could be out of control, which will be E11.65. So we're just going to put a dash there, but you know to use the E11. Okay? So that's how you can ask yourself those questions right there. Now to use this table here, it says when you're reporting E11, right? This is how these is going to go up. Are there any complications documented? Right? Is the type, you're going to start here, and is the type of diabetes documented? Yes, you're going to go this way, and no, you're going to go that way. So you start right here. So is the type of diabetes documented? Yes. All right. Now let's find out, how is it documented? Is it type 1? Is it type 2? Is it due to underlying disease? Is it due to drugs or chemicals, or is it due to others? They may say it's type 2. And are there any complications? You're going to refer to the complications if yes. And if no, you're going to document it as in remission. And then if it is in remission, you're going to say yes for E11.8. And if it's no, it's not in remission, you use E11.9. So you start here. You ask yourself your question here. You come down here for yes, you go up there for no. And then you go on this timeline and figure out what type of diabetes it is. Is it type 1 or type 2 or any one of these here? And then let's just say it's type 1. Are there any complications? Yes, it's going to tell you here. No, it's going to tell you that. So this here is really, really, really beneficial. And I love this graph. But I showed it that way just so that you know how to use it. Always start here and ask yourself the question here. You're either going to come yes, down to yes, or go up to no. Okay? And then you're going to come over and ask yourself these questions here. Okay? All right. Now, let's go ahead and highlight in this paragraph here. These are if they're being treated with hypoglycemic drugs, oral hypoglycemic drugs. this here. It says hypoglycemic drugs and insulin. You're going to code Z79.4 and Z79.84. If the patient is treated with both insulin and injectables, you're going to code the insulin and the injectable. If the patient is treated with both oral drugs and injectable, you're going to go for Z79.84 and Z79.85. Okay? And Z79.4 should not be assigned if insulin is given temporarily to bring a type 2 diabetes blood sugar under control during an encounter. So we're going to highlight this because this particular guideline states that if someone is anywhere, rather if it's in the doctor's office or in an emergency room or in the hospital, and they are giving them insulin, and let's go ahead and put an asterisk right here, and they're giving them insulin just to bring their levels down, but they've never been diagnosed with diabetes, do not code this. So it says it should not be assigned, and that's what we're going to underline. Should not be assigned. Okay? Hope that makes sense. So this is you understanding your guidelines. All right, let's go ahead and turn that page. I probably can open the book back up now, but I'll sit right there. Okay. All right, so let's go ahead and let's do our highlighting. 4, 5, 6. That's all we got. We just got the 6. Okay. Now we're going to write a couple things in here. So right by number 5, 5A. I want you guys to write this here because this is the order that you need to code this for this section here. So the first code is going to be T85.6. The second code is going to be the T38.3X. What it says there. I'm going to go 3X and I'm going to do a dash right there so you know to fill that in. The third is going to be the type. Okay. And then the fourth is going to be the other complication. Now, like I said, my handwriting ain't all that great. But hey, look, you're going to know how to code it in sequential order. You're going to know how to code it in sequential order. So that's 5A. That's where you would do that. Now, when we come down to 6, now we're going to highlight in 6. Due to underlying, we're going to do that one right there. Right there. In E13. Stop at E13. Okay. And then we're going to write a note right here. Read tab list. This means read tabular list, meaning when you go to the code, read your tabular list. So when you go to it, just read what they have there. All right. Now, so we're going to write a couple things here because we need some more things to stick out. Under there also, when you are coding here, right under, we're going to go under 6, number 6 itself. The way that you code this here is this area here. You want to put E89.1 First is going to be E89.1. Second is going to be E13. Point, and we're going to do a dash. Then you want to go third. It should be Z90.4. Hopefully that's the code, y'all. Because the crazy thing is I can't read my own handwriting. And number 4, Z79.4. All right. And then under A, we have two things. Two things we're going to write here. So right here, we're going to put pre-existing diabetes exists prior to pregnancy. Pre-existing diabetes exist prior to pregnancy. Okay. And this is the order that you want to code it. Number 1 should be O24. Number 2 should be E11.9. Number 3 should be Z79.4 if they're on insulin. And number 4 should be Z3A for the weeks of gestation. All right. And then if the gestational caused by pregnancy. So we're going to just put a line right here. And we're going to put gestational caused by pregnancy. Number 1 is going to be O24.4, and number 2 is going to be Z3A. Point, and we're going to put that dash because we're going to need some extra digits there. All right. We getting our notes in. We getting our notes in. All right. So we can put this line here for that. And then we can put this line here for this. All right. So let's do this. We're going to go A. And I'm just going to do this. Okay. Yes, we are making things stand out, and we're putting our notes in here. Okay, that's B. And under B, we're going to go with categories there. And then your secondary is going to say the E89.1. And then this secondary here, we should have it. Okay, so we're good with that. Now we got obesity. And this is a new guideline. So because this is a new guideline, we're going to go ahead and highlight obesity and then obesity class. We're just going to highlight this whole thing. It's a new guideline. And then go up to obesity class. Oh, and do that. And then That should have been here. Okay, so let's see if we can make some things stand out. So basically, if someone is overweight and obesity, it's telling you what codes to use. So if it is drug-induced obesity, you're using this one here. We're just going to underline that. And if it's related to effects of obesity, such as E66.2, related to effects of obesity. And then, of course, if someone is pregnant with obesity, pregnancy. Let's do that. And then you have your class, because that's what this is. And I think there's like 3 classes or whatever. Yeah, because see how it shows you class 3 here. So let's just go ahead and just do this here. Class. And it says it requires a 5th character. So you're going to, whatever class it is per the documentation is how you're going to put it. All right, we're done with that. We are now in chapter 5. We are in chapter 5. So let's make some things stand out. We have pain, A, B, all right. And if you guys want to do this, like I said, you could do it how you want to. It does not matter to me. And then under number 2, definitely highlight that. But if use and abuse, it's abuse. If they have abuse and dependence, it's dependence. If they have abuse, abuse, and dependence, it's dependence. And if they have both use and dependence, it's dependence. So how can we make that stand out is underline that, and it's going to be that. Underline this, and it's going to be that. Underline this, and it's going to be that. And underline this, and it's going to be that. That's how you make that stand out. Okay? And we do have to do our G89 should not be assigned. Under A, it says G89 should not be assigned code with that. Okay. And then you have this one line right here. That first line. All right. And then number 1, when you go under remission, you want to highlight remission, in remission. And you should be using these category codes right there. And then mild substance right here. I want you to highlight that sentence until you get to remission, which is on the 2nd line. Okay. Under number 3, all of these codes. This is the area where you should be at for psychoactive substance use unspecified. For number 4, you should be fine. Number 5, you should be fine. And let's turn the page. Okay. And now we're in number 6. You can do a star. This is a graph. So when use and abuse, you code dependence. This is how it kind of shows you or whatever. Dependence takes it takes priority over dependence, abuse, and then use. That's how it goes. Takes precedence. And under factitious disorder, C. And D for dementia. Factitious disorder, you want to go to right here, Munchausen's syndrome, and highlight all of that. Okay. All right. Now for under dominant and, oh, we can keep our orange. For A, we want to highlight all the way until we get to here, G89.3. So stop at the G83.3, I'm sorry. And then we definitely want to make sure we highlight that. And what you want to do is, if a person is ambidextrous, the default should be dominant. If they're left-sided, default should be non-dominant. And if they're right-sided, it should be dominant. That's how you want to make sure you know what that is there. Pain, general information, B, let's go, A, B, we got number 2, number 3, number 4, number 5. All right, let's make some things stand out. For pain, this is your general coding information. Okay. And the general coding information is acute or chronic pain right here. That's what you want to make sure you highlight. And then this is if the pain, this whole paragraph right here, from here to here. Okay. And then if a code in this category, G89, highlight that, G89. And then in A, you want to highlight this paragraph. All right. And then you could basically just kind of like do this, those bullets. And then B, you want to make sure you have I assigning. Okay. And make sure you have your bullets. And here, under I, we need that the first 3 lines all the way start at code from category, and we're going to end at additional information, which will be right here. Here's your information. So code everything else above there. Right there. Okay. Under number 3, the provider's documentation should never be used to guide the code of postoperative pain. Highlight that. Stop at the word pain. And then for A, We're just highlighting. And we're highlighting B. We're going chapter 19 to let you know for those additional codes and right there, category G89. And then for chronic pain, it's going to be G89 too. For neoplasm related pain, is going to be G89 3. So that's how we're going to make those stand out. And now we're going to go to page G16. And we're going to have chapter 7, 8, and 9 on this page, but we're going to finish this up. And I'm going to break this down into two sections. Since it's 22, I'm going to stop at chapter 11, and then we'll start back up on the next one with chapter 12 and then complete it out. So I wanted to do it like this here to make sure that you're capturing this here. All right, so for chronic pain, let's go. We got G89 2 for that one. No, chronic syndrome. I'm sorry. And that's going to be that G89.0. Okay. Chapter 7. Assign as many codes from category H40. And we're going to go ahead and do glaucoma. And assign glaucoma codes number 2, number 3, number 4, 5, and 6. All right. Now under number 2, we want to highlight this whole paragraph right here. All right. Under number 2, that whole paragraph. And then when you get to this second paragraph, start it at does not, which is right here, and complete it out. Finish highlighting. Does not. Right there. Under number 3, we're going to assign, which is up here, and finish it out till you get to glaucoma. Okay. And then in the second paragraph, you got H40. Let you know these subcategories H40. And it says assign 1 code for each type of glaucoma. Do that whole sentence right there. And you should have that. As well as in that third paragraph, you want to do the same thing as well. H40 and H20. And then finish that out. All right. And then when you get to number 4 and number 5, so I think we completed out number 4. I think I'm good on 4. Yeah, I'm good on 4. Number 5. So right here, we're going to write something right there. Number 5, on the side, you can either write it here or right here. But you can write, and I'm going to write mines on this side here. And I'm going to put, make sure it's on an open angle. And then I'm going to do angle. And I'm going to do closure, glaucoma, and we're going to go H40.11x1. All right. And that's going to be right here by this area here. So we know. And now, since we did that, all right, so we're going to do fourth is for indeterminate, right? And then it says character 4, and do that whole line until you get to determined. Clinically 4, character 4 is used for glaucomas whose stage cannot be clinically determined. Under blindness, I want you to highlight the first 2 lines. Line 1, line 2. And then we're going to start again over here at if blindness in one eye, assign code from here. And do if blindness, and you're going to do both eyes are affected. You sign that right there. Okay. Now, of course, what this here is, this is another graph, and I love this graph. This graph, honestly, this graph is going into for chapter 9. So first and foremost, let's just go ahead, and even though we have chapter 9 here, we want to just put chapter 9 here, so we know. Okay, now hypertension, because you have 3 different codes for hypertension. Hypertension heart is I11.0. Hypertension itself is I10. And then hypertension with CKD is I12.9. Oh, well, we're going to do the dash. We'll do the dash. Do the dash. I12 and dash. Okay. That lets you know like what area that you're in. But I love how they have this here. So if you have hypertension, and if it's with heart disease, yes. Or if it's with CKD, yes. Then it's telling you, just follow the graph and just answer what you need. No, or yes. Type of heart disease, failure, and CKD. And if you want, you can do I13 in this area right here. Put a 0 and then put a dash. I mean a point and then put a dash. I13 point and then put a dash. So that's how you use this chart. So regular hypertension, hypertension with heart, hypertension with CKD, hypertension with heart and CKD. Okay. Let's go ahead and make that stand out. And then it says right here, this perfect sentence right here. The classification presumes a causal relationship between hypertension, Heart involvement and kidney. We're going to highlight all of that. Okay. Now, hypertension with heart, CKD, heart and CKD. And I'm just doing this 5, 6, 7, 8, 9, 10, 11, 12. And let's stop there so we can put some stuff on here. All right, so hypertension with heart disease, I-11 category. Hypertension chronic kidney disease, I-12 category. Hypertensive heart and CKD, I-13 category. Okay, we definitely need to make those so we know how we need to code that. All right. Everybody got that? Let's go to number 1. And under number 1, let's go ahead and we're going to highlight, because you also have to classify the heart failure. We're going to do this. Just have one line up there. And it's going to tell you to do this here. And it says use additional codes from category I-50 or I-51. And we want to make that stand out right there. Use additional. There you go. Number 2, we're going to do the same thing. It says right here, I-12, even though we already made it stand out. And it says the appropriate code from N18 should be used as secondary diagnosis. So go ahead and highlight that. Okay. And we're going to circle N18. So here, let's make this make sense. Your first code is going to be I-11 point. We're just going to do that. And your second code should be I-50 point. And that. For this area here, it should be I-12 point. And then the second code should be N18 point. And remember, when we put in these dashes, we don't know what that last dash is because it's going to be per your documentation. And then this here area is going to be I-13 point and dash. And then it says you're going to use appropriate code from the CKD and code heart. So you can go, I'm trying to see how they have the guideline if they're telling you to do the heart first. Okay, so we can go I-50 point, and then you're going to go the CKD, which would be N18 point. So this is how, these are your sequences. You could never go wrong. You could never go wrong. And then for this area here, same thing. Because you got both. Because you have both. So we're going to go I-50 and then N18. Okay. And then we're going to highlight this last paragraph. And we're going to underline acute renal failure. Okay. All right. If it's hypertension cerebrovascular disease, it's going to be in this area. Hypertension with retinopathy is going to be in this area. Hypertension secondary is going to be in this area, I-15. Hypertension transient is going to be in this area because this means they have high blood pressure without the diagnosis of hypertension. So I want you guys to highlight those. In number 4, I only highlighted I-60-I-69. In number 5, I highlighted H35.0. Number 6, I highlighted I-15. And number 7, I highlighted R03.0. Number 8, I'm going to highlight I-10 to I-15. Number 9, it says uncontrolled is going to be, of course, still in I-10 to I-15. Number 10, when you're in crisis, is going to go to I-16. Number 11, pulmonary will be I-27. Number 12, hypertension resistant, it'll be in I-11A. Okay, so those are the areas. It's telling you what areas you need to be in. And once you know what area you need to be in, then per your documentation, you'll be able to figure out what the rest of it is. So now we're on B. And right here, we want to write the word angina. We just want to write the word pain in parentheses right there. Okay. And then underneath this paragraph here, we're going to highlight this paragraph. We're under second column B, this second paragraph. And then when you code this, the first code is going to be the actual AMI. And then the second code is going to be the I-25.4. So write that in sequential order so that you know. Under C, intraoperative, we're going to go ahead and let's do C and D. Under C, your first code is going to be I-97. And the second code is going to be I-67. And of course, I'm always going to put my dashes next there. And make sure it's clear for you. And I'm sorry, I should have put, I'm sorry. Let's put a line. Second is going to be I-10 to I-67. Sorry about that. Okay. In D, and this is going to be this area right here. And then it says I-60 to I-67 is the causes of the sequela. That's what you want to highlight right there under D1. I-60-I-67 as the cause of sequela. And then you want to highlight this entire paragraph along with these bullets. So what we'll do is highlight the paragraph. We're going to put a line down the bullets, but we're going to highlight this entire paragraph right here. Okay, and highlight those bullets. And then in number 2, this is the category I-69 again. You just want to make sure you're in the right area. We're going to highlight number 2. Turn the next page. Page G18, number 3. At the top, go ahead and highlight this. And then we want to write Z86. Let me see if it says it here. It does not. So for this here, we want to write Z86.73 can never be primary. Meaning this code can never be in a primary diagnosis spot. Can't be the first code. All right. Now we're coming into we're going to highlight this area right here. I'm going to do it with the orange. And we're going to put a line. And then right next to it, I want to put, this is your AMIs. And let's go ahead and do that. Okay. So now let's go into our number 1. Let's go ahead and highlight number 2, 3, 4, 5, 6. All right. Now let's see how we can make this area here stand out so that we are aware. So first and foremost, when we have an AI, we know we're going to have them from these categories right there. Go ahead and highlight those categories in that first paragraph. And then come down right here. It says code I-21.4, non-STEMI, and let's go ahead and complete that paragraph, that sentence. Okay. And then it says, for encounters, right here, let's highlight 4 weeks old. And we're also going to put 28 days. We're going to put 28 days. That's what the 4 weeks consist of. All right. And then in this particular paragraph still, when we get codes from right here, codes from category I-21 may continue to be reported, but I want you to highlight this all the way until you get to the last sentence. All of that. Okay. Number 2, we're going to highlight I-21.9. And then I-21.3. Because that's the STEMI. Under number 4, We're going to skip to number 4. It says within the 4-week time frame, which is 1, 2, 3, 4, fourth line, within the 4-week time frame of the AMI, okay, highlight those 2 lines right there. And when you get to this 3rd paragraph, in this 3rd paragraph, it says, if a subsequent myocardial infarction of one type occurs within, what we're going to do is we're going to put a line through the word within, and we're going to write the word after. Okay? Now we're writing this word after, but we're also going to write something else there. And what we want to write is greater than 4 weeks. So I'm going to turn my book again. And for this area, we're going to go greater than 4 weeks. And then we're going to go first code should be I-21. And second code should be I-25.2. And you could do your book this way here if you want to as well, so that you can read it that way. That's fine too. Okay. And then number 5. In number 5, we're gonna highlight type. Where's my, oh, here it is. Number 5. Under number 5, let's go ahead and highlight in that first paragraph, type 1 myocardial. Okay. Type 2 in the second. And then I-21.A1 is right there. Okay. And then this paragraph here, let's go ahead and highlight this entire this entire line right here. And then this 3rd paragraph right here, we just want to do types right there. Okay. Now we're in chapter 10. And in chapter 10, all right, let's go ahead with our numbers, our letters. Let's go A, B, C. All right. A1. All right, we don't have anything. B1. And then underneath there, we want to do J96.0, J96.2. And we're going to do J96.1. And then when we do number 2, we're going to write second J96.0. All right. Number 3, we're going to highlight. And remember, we only completing this book so that we know. All right. So number 1 by number 3. We're right here. Let me see. Is it under C? Nope, it's right here. So we're about to write something here. RFE. And it's going to say J96.0 or other condition. And I'm pretty sure y'all are writing neater than me. Second will be J96. Or other condition. Okay. And then under C, we're going to highlight that first. Let's stop at J10 right there. So we're going to stop at J. Oh, wrong one. Stop at J10. Okay. Now, RFE, reason for the encounter. RFE, reason for the encounter. I'm sorry, I didn't say that. Now, a patient is admitted with acute respiratory failure. Is the acute respiratory failure the primary reason for the admission? Yes, you come here. No, you come here. It's telling you exactly what to code. This is great as well. You can highlight whatever you need to in this area as well. So let's just do this here so we know what they're asking in there. All right. And then this last area, D, E, and F, D and E. We're going to do that and E. And then for here, under here, so under number 1, okay, it says code J96851, J95851. You want to highlight that. And then let's come over here to an additional. And you want to highlight until you get to the end of that sentence. So go ahead and we're going to stop at the pneumonia. Or the end of the paragraph, I should say. Okay. Number 2, we're going to highlight this subcategory for this. Oh, that should have been orange, y'all. That's okay. And then underneath here, we have vaping related disorder is that. And then it says assign additional code for other manifestations. Okay. Now, this concludes part 1 of ICD-10-CM section 1 under C, chapter specific guidelines. So this we're going to end right here at chapter 11. Part 2 will cover chapters 12 to 22. Thank you and happy coding.